There are 14 million cancer survivors in the United States today and 18 million predicted by 2022. How can we meet their needs? One of our primary goals of integrative cancer care is to monitor and manage the cancer terrain, to transform the microenvironment that surrounds our cells. We want to promote a microenvironment, an extracellular and intracellular physiology that's not permissive of the development, growth, or metastatic spread of tumor cells. This is how we can create a physiology that is inhospitable and non-permissive of cancer. Much in the same way that we create healthy soil so we can grow healthy plants instead of weeds, we can also alter the tumor cell environment to support healthy cells and inhibit the development and progression and spread of cancer cells. Let's discuss some of the unique factors in the physiology of cancer and how you can use this information to identify patients at risk, reduce risk, and intervene early. First, I'd like to discuss hypercoagulation in the context of cancer. Hypercoagulation is prominent in the cancer terrain. Many tumor cells induce hypercoagulation, and many chemotherapy agents also cause hypercoagulation. This puts patients in an overall 7-fold higher risk for thromboembolism, cerebrovascular event, or a myocardial infarction, all life-threatening. The most common cause of mortality or life-threatening and debilitating complications in cancer patients is actually embolism or infarct. Patients with hematologic cancers have a 28-fold higher risk of coagulopathies, embolisms, and life-threatening hematologic events. Cancer patients frequently die of hematologic complications such as embolisms or suffer strokes caused by their cancer-related hypercoagulation. You can monitor and manage this risk as part of your patient's team. Surprisingly, many oncologists do not monitor and do not manage these risks at early stages of development. I recommend vigilant monitoring and early intervention to keep our patients safe. In the primary care setting, by monitoring patients for hypercoagulation, you may be the first care provider to raise the question of early detection of the presence of cancer in the first place, or you may be the first care provider to recognize the earliest signs of a cancer recurrence or progression. Patients over 45 should be monitored for hematologic changes and coagulopathies, as changes in coagulation and hematologic factors reflect not only cardiovascular risk, but also increased cancer risk. The primary care physician may be the first care provider to discover this early warning sign of cancer. Once evidence of hypercoagulation has been identified, these patients should be followed up to assess if these changes in coagulation reflect malignancy. I recommend getting a baseline and continue by following your patient's fibrinogen activity and D-dimer levels at regular intervals. What can you do for these patients? Skilled use of omega-3 fatty acids, proteolytic enzymes such as bromelain, lumbrokinase, and nattokinase, and carefully selected botanicals such as curcumin may decrease fibrinogen formation and inhibit platelet aggregation and create a more normal hematologic environment without increasing risk of hemorrhage and clotting time. Curcumin and boswellia and proteolytic enzymes such as bromelain and unique enzymes such as serrapeptidase, nattokinase, and lumbrokinase can all be used to alter coagulation factors. Omega-3 fatty acids not only inhibit platelet aggregation, but also enhance normal inflammation control through their effects on prostaglandins and thromboxanes, and may act synergistically to enhance the response of some chemotherapy agents. Please watch for our next video in which I share some clinical pearls and show you how to monitor cancer patients and cancer survivors for functional damage and for unique risk factors. I hope you'll join me for my comprehensive Foundations of Integrative Oncology course, which includes monthly live grand round calls with me where you can ask your questions. You can start transforming your practice today so that you can become the go-to expert who is truly prepared for the rising tide of cancer patients and survivors who are looking for a skilled and knowledgeable clinician who can provide them with the health side of the cancer equation and help them take control of their health and support them through all phases of the cancer journey and beyond. Click on the link below now to get immediate access to all of the modules, print-on-demand patient support documents, and quick reference clinician guides, as well as learn how this course has transformed the way other clinicians like you practice.